The vast majority of breast cancers are actually not caused by a genetic mutation. Only about 5 to 10% of breast cancers are caused by a gene mutation. And a gene mutation is a mutation that you potentially inherit from your parents that placed you at a higher risk of getting breast cancer among other cancers. So different genetic mutations place you at different risks for developing the breast cancer among the other cancers as well. Some women come to see us because they have an extensive family history, and even some have the gene mutations running in the family. The biggest ones that most people think about are the BRCA mutations or BRCA mutations. When it's become popular on TV with Angelina Jolie having that genetic mutation and choosing to have a bilateral mastectomy. So many women come in having seen that and are curious about having testing done. We do reserve testing for people that qualify. There's different criteria that patients have to meet to qualify for genetic testing, because as I said, the vast majority are not caused by a gene mutation, but we really want to know the ones that do have a mutation or are at risk to have one. If a patient comes to see me and has a known gene mutation that runs in the family, we would have them see the genetic counselor, and they can get tested for the same mutation that is found in their family members. If patients come in with a breast cancer, is usually what happens. They come in with a breast cancer. We ask them about different cancers that run in the family, and if we feel that they're at risk, then we would send them to the genetic counselor, who can do a more thorough family history and then send different tests for different genes. It's usually either a blood test or a saliva sample, so pretty simple, and they can figure out if they're positive for any of those genes. Some women that don't have a gene mutation but are at a higher lifetime risk of developing a breast cancer can qualify for additional screening measures. So in the average woman, she would need a mammogram every year, and some women would require an ultrasound in addition to the mammogram. The patients that are at higher increased lifetime risk of developing a breast cancer, many of them qualify for an MRI test as well, so that they actually have a screening test every 6 months to hopefully catch any cancer sooner if it were to develop. I would say that any person that if somebody's worried about having a strong family history, their primary doctor can always get them to see a breast surgeon, and we're happy to kind of go over that with them.